first, let's talk about manpower gap that you talked about. How many doctors are there under the FCT administration? How many do we need? Because this is the nation's capital. That's on one hand.
Right.
As far as resident doctors, how many do we have? If you have that number, how many do we need to close that gap? And the second part is, when you talk about the arrears being owed, I think you mentioned the months. In total, how much are we talking about here? So those two questions.
Okay, so let me start with the shortage of manpower, because in the FCTA administration, we have 14 district and general hospitals, and then we have the primary health care and the health insurance in charge. So, and in these cases, in some of the hospitals, we don't even have specialists. We don't have enough medical officers and resident doctors. So the last time that there was a calculation of how many of these we'll need, we're going to need as much as 200 or thereabouts. We don't even have anything close to that now. For example, we don't have any plastic surgeon in the whole of the hospital. The one that we had at left is not being replaced. We don't have rheumatologists. Maybe we have just one. We have like only 1 or 2 orthopedic surgeons, and the workload on those people are so many that they cannot even give their best to the patients when they need them. We don't have enough resident doctors. And right now, there is a collation of how many of these healthcare workers, especially doctors, we need in the system. The last one was about 300 to be employed, including medical officers, resident doctors, and specialists. And the last employment that was done in 2011. What we have had since 2011 has been replacement. And the replacement has been scantily done in such a way that those that have left or those that have died have not been replaceable till now. So the work burden is so much. And of course, we don't even have house officers. And these are the ones that can also help to reduce the workload, but we don't have them employed at the moment. So it's so difficult. And that is why you see a doctor having to see as many as 30 patients, 40 patients, or you see a doctor doing like 10 to 11 cesarean sections in a day, and this same doctor is going to do the clinic the following morning till the afternoon and probably go home. He's mentally drained, psychologically drained, and then he's not even giving his best to the patient. So that is very dangerous at the moment.
Absolutely, and we totally agree with you, Dr. Ebon. We must indeed commend you and your colleagues who have stayed behind, especially with the Japa syndrome. A lot of our medical practitioners, have had to leave the country. But again, remind us what the standard practice is according to the WHO, that's the World Health Organization. How many doctors to a patient again?
It should be about a doctor to like 230, 250 patients.
A doctor to 230, 250 patients?
That's correct.
What do we have in Nigeria right now in the FCT where you are?
Well, we have like a doctor to like 10,000 patients.